sexual health is a part of your diabetes self-management, just as insulin and any other medications and checking your blood sugar. Knowing what you're doing in regards to that piece of your life is really important because it can really affect your diabetes. Sex, like exercise, is going to affect people pretty differently. For most people, it will probably drop your blood sugar just because it is pretty much a workout. If you have a low blood sugar or you have an above target blood sugar, it's going to make it a little bit more difficult probably for you to feel like you want to have sex or to feel like you're enjoying it.
When somebody has very high blood sugar, either in the moment or chronically, it can make arousal more difficult, and that's for both men and women.
Lube can be a very useful tool, not only in terms of sex and pleasure, but if someone's experiencing vaginal dryness, it can really help. There's a couple different kinds of lube out there. The two that we usually recommend because they are condom safe is water-based or silicone. If someone is very sensitive and feels like they might be more prone to yeast infections or UTIs or bacterial vaginosis or any of those fun vaginitis symptoms that so many of us deal with on a frequent basis.
The ability to orgasm requires a lot of different systems, like all working together at the same time. The blood vessels, the nerves, the brain. And in somebody who has elevated blood sugars in that moment, or chronically elevated blood sugars that have harmed the nerves and blood vessels, it's not surprising that folks with diabetes may have a difficult time orgasming. If this is happening, similar to libido or arousal issues, this is something you should bring up with your endocrinologist because it can be a sign that something greater is going on.
Stress affects your libido. Feeling sick affects your libido, your hormone levels, your age, what's going on in your life, mental health, physical health, all kinds of things can affect it.
One of the things that diabetes puts you at risk for in general is going to be UTIs, especially people with a vagina. That urethra is going to be longer and it just is going to put you more at risk for it. Doesn't mean that bodies with penis can't get it, but both people can, but more so in the other party. The reason for that, of course, is that your kidneys flush out extra sugar through your urine, and sugar feeds bacteria and yeast.
What any infection can do, yeast infections, urinary tract infections, STIs, or a common cold, any of those infections can put the body in a state of stress, and that can sometimes lead to higher blood sugars. So it's just kind of worth noting that blood sugars might be higher when you're undergoing treatment for any infection. STIs, or sexually transmitted infections, are really common and happen to many people. And they're just kind of, in a way, part of growing up. A person with diabetes is no more likely to contract a sexually transmitted infection or an STI compared to a person without diabetes. You should ask your doctor to be tested if you're worried at all. Your provider, no matter what kind of provider they are, is able to order testing for STI, and it's really easy. It's usually just a urine test and maybe a blood draw, depending on what you're worried about.
There's a number of different ways to prevent STIs. Obviously, safer sex is one of the easy ones, using barriers, things like condoms, dental dams, internal condoms.
Contraception can be helpful for people with diabetes.
Birth control or prevention of HIV through the use of PrEP can increase blood sugar levels and may make glucose tolerance change a bit. There's going to be some difficulty managing the blood sugar, but it is so important for prevention and managing blood sugar with an HIV infection or with an unplanned pregnancy is going to be even more difficult.
There are lots of forms of birth control. Not everybody wants to be on hormonal contraception. Lots of people will struggle with taking a pill every day. Some folks don't want to have anything like inside their body. I mean, you got enough, right?
An unplanned pregnancy with diabetes can be very, very complicated. So we want to make sure that we are preventing that situation if we can.
And obviously, birth control is there to help you. It shouldn't make you feel sick or it shouldn't make you feel bad. So if, the side effects that you're feeling when you first start a method are just completely untenable for you, talk to your nurse or doctor. But usually, 3 months or so is a good length of time to give it to have your body kind of adjust to whatever method you're using, if you're using something with hormones. And even the non-hormonal IUD, like that can take a while for your body to kind of adjust to it.
If you're allergic to latex, they have polyurethane. They have all sorts of different types of materials now that won't cause an allergic reaction. Barrier methods and lubes. That can help. Then you do need to have a close working relationship with your doctor.
Having a provider, a gynecologist that is aware of your diabetes and well-versed in that is going to be really helpful.